pay attention. So when you are reading the station, you are about to see Mrs. Stacy, so you know her name. Okay, so it should be like, you should, when she tells you her name, you should know that you have read the same name in the case scenario. And then the age, 40 years is the age. Okay, so 40 years means, if she now you move ahead, she is in midwifery unit. You know, she may be for labor or delivery purpose. So 40 year, what is the age when we offer delivery at 39 weeks? It is more than 39 years. Okay, so in elderly primary we advise delivery to happen after 39 weeks to avoid increased risk of stillbirth. Okay, so this age is important, you have to note it. It is in the TOG of elderly primary. Okay, so now you have to see what next. She's in alongside midwifery unit. Okay, she has been in labor pains from last 8 hours. So alongside midwifery unit means she is just near the hospital or within the hospital campus. She has been in the labor pains from last 8 hours. She is having pains. There is no idea about the gravida or parity, so we will ask it in our history. She is 4 centimeter and want no intervention. So what all we have to see, she is 4 centimeter. So maybe she is in active labor, or maybe she is still in the early stages of active labor, and want no intervention and want water birth. She want to keep her labor as natural as possible. That means, okay, uh, midwife noticed her water broke and her liquor is meconium stained. So now what else you know? You know she is an elderly patient. You know she is in labor from last 8 hours. You know she is only 4 centimeter. Okay, and she want no intervention also. So that's again a kind of a station. You need to put your efforts and the negotiating and communicating skills with the patient. So midwife has already done the PV, and she has seen that water has broke at 4 centimeter and liquor is meconium stained. Means in early stages of labor only she has a meconium stained liquor. Okay, but according to our guidelines, we don't offer cesarean section for meconium stained. We have to monitor her with the CTG, or with the intermittent auscultation also we can monitor her, because it is only meconium stained, and BP is 140 by 90. Yeah, so this is hypertension, and urine protein is +1. So that is preeclampsia now. So midwife want you to meet her and discuss the plan of birth with her. So what all are the points here? There are many points to be now you have to make script in your mind, or in your notes. If you want to make notes, you can just realize that you have to pay attention towards a long labor and a meconium stain liquor, early stages of labor, and also preeclampsia. So what three parts you are going to work upon? One, you have to ask her concern about the intervention and water birth, no intervention in water birth, why she's after this. And then you have to support her ideas as well, asking about the partner as well. And apart from that, you have to tell her about the meconium stain liquor, also about the preeclampsia and its risk to her and to baby, meconium stain liquor risk to the baby. This all you have to, and how are you going to manage her from now? This all you have to cover. So you are dividing it in three parts now. One is negotiation about water birth. Second is negotiation about the and making her understand about the meconium staining of the liquor. Third is preeclampsia. So now these are the tasks you have to do. Okay, so if you have already done the station or practiced this station, even in separate parts like meconium staining in separate ways, like, and you know the guideline, like what does it say if there is a meconium staining of liquor and she's in early stages, how will you counsel her? So this is a very important recall also, and it's an important negotiation station which will be um, guys, is my screen visible to all of you? Okay, so um, let's start this. So here, how I will be doing this station, I'll be meeting the woman. and will introduce myself that I am ST5 working doctor on duty in the labor ward. May I confirm your name and age? She'll be saying so and so, like Julie or Juliet, and 40 years old, or what is her name in the previous slide, Mrs. Stacy. So, Mrs. Stacy, I'm Mrs. Stacy, 40 years old. How would you like me to address you? Yeah, Stacy will be fine, or whatever she says, you have to follow that. Okay, you can call me so and so, whatever your nickname is, or your name is, or your surname is, Dr. Kaur or JP, or whatever you want to say. Okay, you can call me this, and I can see you're having pains. Midwife has called me because she had certain concerns, Mrs. Stacy. Um, may I know where is your partner with you or someone with you here? Whatever she'll say that he has gone here and there, and okay, so I will wait for your partner and we will discuss your condition with him as well. But first of all, I want to know few details from you, and then we can talk what are the midwife's concern, and we can make a safe and suitable management plan for you. How does that sound? Okay, yeah. And whenever if she is in pain, she is mimicking a pain, just stay quiet, and if she is a term patient having a labor and it is good for her, then you just say yes, very good, you are doing quite well. Just take a deep breath in, take a deep breath out. Yes, very good, you're doing really well. And she's in early stage, so you say just take deep breaths, and please do not push at this stage, okay, even if you feel like pushing. Yeah, that would be great. Okay, yeah, very good. Like this, some unspoken language, like verbal non-verbal communication skills, what we say in our books also we read. So you have to show that, like we do it in our OPD patients. Sometimes we don't say anything and we are just listening to them and nodding our head, and expressions we are changing according to patient's condition. So accordingly you don't have to show pity that she's having a pain, oh poor girl. No, just buck her up. Yes, you can do it. Yeah, you're doing well. That's good. Okay, so ask about the present details from her, since when you're having pain. Okay, and is it good, like uh, is it more intense, you're feeling it more intense, or they are tolerable? Okay, and have you got any pain relief, since when it started, and how frequently it is coming? Okay, and do you feel your water broke? What is the color of your water? Okay, have you noticed this? Are you using a pad? Okay, and have you named the baby? Okay, Jack is a lovely name, and is Jack kicking you well? Okay, and now you have asked the labor details, and it is written also that she is having labor pains from 4 hours, but you have to ask about strength, frequency, and duration. Okay, so now color of liquor we have to ask. Now any bleeding? Okay, and about the blood pressure, she is having high, so you have to simultaneously rule out the features of preeclampsia also. So uh, like three ways we are going. We know she is in pain, early labor, long labor it can be. So you have to ask her about the labor pain, onset, strength, and how frequently it is coming. And then she is having meconium stain like you have to ask her when she had started leaking, does she know that, and what is the color of the leak? Okay, and baby kicks, still you know that it is a meconium stain like it has already been given, but you have to ask patient, it is in the information gathering part. And if in your station they don't ask you for getting information gathering much, then you can skip many of the points, and you can, if you know it is meconium stain, don't ask about leaking, and just that midwife has done the ARM. So go according to the uh, to the task which has been given you. And now preeclampsia, ask about, do you have any headache? Do you feel unwell? Is there any pain below your ribs? Do you feel any flashes of lights or any blurring of vision? Yeah, so that we need to ask. Okay. So now, you will be also asking the previous pregnancy detail. Is this your first pregnancy? How far you? Because first you have to talk about emergency and the emergency features. So emergency is that she is in labor. So that's the emergency, and you have to take all the labor details, and that's the emergency. She has meconium stain like her. You have to take leaking details. You have to take any bleeding also if she has noticed. You have to ask about the baby kicks if she is feeling. Then preeclampsia, headache, blurring of vision, pain below ribs, these all things you have to rule out any sign and symptom of having impending eclampsia because she is having preeclampsia. And then previous pregnancy, present pregnancy detail, how far you are in this pregnancy, is this your first pregnancy, and how has been pregnancy so far, is there any concern about dating scan, your booking bloods, were all they fine, yeah, any and your growth scans, baby's growth, Jack's growth scans, and 20-week scan. Okay, quickly you have to just ratify these things, that how far you are, how has been this pregnancy so far, or how about your booking blood scannings, your Down syndrome screening, your dating scan, yeah, and your 20-week scan. So and then you will, if it is her second or third pregnancy, you will take detail about the previous pregnancies also. Was it a cesarean section, was it a normal vaginal birth, was there any concern, any instruments being applied, you know, like that you have to uh, ask her about the past pregnancy. And in the past pregnancy you will ask about mode of delivery, place of delivery, and then mode, place, and any complications after that delivery. Okay, so these are the 3 points which you have to ask. Complications, it can be fetal, it can be maternal. So if there was any, then she will tell you. And but you have to speak a word. Was there any complication after that past pregnancy? And then in the medical history, you have to rule out hypertension. Was there any previous history of hypertension? Any sugars, any clot problem? Okay, quickly you will ask two three things. Any medical illness she has, drug allergy, blood group, these we cannot miss. Okay, and also Jehovah Witness, that will again be a safety point. You have to ask whether there are any blood reservations, because if she'll be having a long labor or any risk factor in the labor, she's having preeclampsia also, so pph can also be a consequence, or it can follow after the delivery. So you have to ask here Jehovah Witness whether she is having any blood transfusion reservations. Then you have to ask about the social support, yeah, that if she how is the support at home, where is her partner, if partner is along with her, then is he supportive, does she need extra help, okay, at home or here, and then weight to height ratio. So like this you have to take the information gathering. And if, even if, like, this is the basic template that you can use, and you should be knowing it by heart, that what you have to do as the leading questions, so if you don't ask in medical history the drug allergies and blood group and geo witness, so your asterisk point, or your patient safety point will be reduced. And I mean, this is an example like how they mark us for the patient safety, because these are the basic requirements. And if you don't ask about any sign and symptom of preeclampsia, whether you have it in the template, so how can you be a safe person that you're not asking her about any sign and symptom, and you are just introducing and taking here and there history and not asking the relevant part. And if she is in labor, you're not taking labor history, then how can you be knowing whether she has the onset even before, or somebody has history is, it is different to you. It can be different in our practice also, it can be different. Patient may say something to midwife and may give some hidden history to you if you poke. Okay, and also the BMI is important because that will change her management completely. So you need to ask BMI, you cannot forget it. Okay, and support is very important in a laboring patient. And if you say that we are here, we will provide you support, it soothe her anxiety level. Then you have to listen to her carefully, that she doesn't, why she doesn't want intervention. then she will definitely come up with any story about her friend that she was not having a good experience, and then forceps was applied and baby was not in a good shape. After that, baby developed jaundice. Then you say, I'm really sorry to hear that. How's the baby doing now? How's your friend doing now? Whatever she has to say, she'll say, I can see that you're really concerned, Mrs. Stacy. Every woman has a different body and they react differently to labor and its, process. So I really have limited idea about your friend, but I would try to be up to your expectations, but I'm here to give you all the facts and the update about your current condition, and then mutually, I will be informing you the things which are happening, and together on the basis of evidences and research, I'll give you the facts also. So together we can make a suitable plan, and whatever you will say, ultimately we are going to do according to your wishes, because you are the one who will decide about your birth plan, right? Yeah, okay. So just be with her and don't show her that you have come here only to tell her that you are thinking wrong and I am right. We don't ever have to show them that we are here to command you. We are here to do a negotiation with you. We are here to provide facts and guidelines. We are here to put the numbers in front of you, and you and your partner are the ones who will decide, and mainly you. And if she says, "No, I want water birth because I don't want any pain relief option," because that can, that was the reason that my friend had the instrument had to be applied, and I don't want any instrument also. Okay, yeah, water births are a natural method of pain relief, and many women opted, and our midwives are really very expert in providing water birth. And you can stay in water as long as you can, and but the thing is, there are certain concerns that have come up. Firstly, I would like to tell you that midwife has examined you now. She has told me that your water broke. Am I right? Yeah, it's right. And you have said that it is greenish in color. Yeah, and that means the baby has pooed inside. Baby has Jack has passed, opened his bowel, and do you want to know what can it cause to Jack, or how can it affect you? Yeah, definitely. Yeah, so when Jack is moving inside and drinking the water around him. So what can happen if Jack takes the water in, which has poo? Then the particles may get stuck up in the this windpipe as well, and in the lungs, and that we call, that can um, cause damage to the lungs even. So Jack may get into distress, and that's why we are worried, and midwife also is worried, though it is just the beginning now. Pooh is not Jack might have passed poo once, and it is like the water around him is getting stained with the poo. So to see it whether baby is affected or not, we would like to advise you frequent monitoring of Jack's heart rate. Okay, so the frequent monitoring is required. So if you go into the water, that much frequently, we won't be able to hear the heart rate, and we never know that when the distress will happen, and that can be difficult, to manage. If we will not diagnose it, then Jack will be really unhappy inside, and we won't be knowing it. How, I mean, that can be very difficult. Sometime babies, if they are not monitored and having this kind of situation, they may even born with no signs of life. That you have to say when she is not able to listen to you or not listening to you. Okay, then you have to use these far terminologies. Otherwise you have to say we have to monitor, so that Jack does not get this heartbeat depression and does not get into difficulty. And then yeah, in the and also one more thing, that you are now in the early stages of labor. So if that remains to continue, your labor may get really prolonged, and then the same thing may happen, that one side Jack has already pooed, and on the other side the stress of long labor on Jack will also make him more vulnerable to get into distress and having a heartbeat problem, or being born with respiratory difficulties and many more that we cannot tell you now. So what I suggest you, or I can offer you, that we shift you to the labor room. Right now you are in alongside unit. If we shift you in the labor room, we will be monitoring it, and we will try to keep your labor as natural as possible. Also, we will allow you to move around in the room between the monitoring, and we may need to start with the hormone drip to expedite the labor process, and also to make Jack comfortable. Okay, and that we about the pain relief, if you will ask for that, we have many options that we can provide you, that according to your progress we can decide and we can discuss together. What do you think? Yeah. Okay. And also, Mrs. Stacy, your blood pressure is coming high, and though when it is in labor, it is coming high, it is not that dangerous, but still, there are proteins also in your urine testing which we have performed. That means you have a condition, you have developed a condition we call in medical terms preeclampsia. How can it affect you and the baby is that on you, it can cause, sometimes it can cause fits or scissor like activity can happen, and that can be really difficult to manage if you are not in an equipped center. Okay, and for Jack also it can cause very much difficulty during fit. Jack may not get the adequate blood flow and nutrition, and can the heart rate can also stop sometimes. So as I've already told you that we have to expedite the labor, so for this condition also the requirement is expedition the labor as early as possible. You should deliver, Mrs. Stacy. Does that make some sense to you? Mm-hmm. Yeah. Okay. So, would you mind if I make notes about shifting you to the labor room? Yeah, okay. Yeah. And if you want to wait for your partner, that's perfectly fine. And also, I will ask the midwife to provide you with some written material and information about the things we have discussed now. Yeah, so you can read it also. Meanwhile, we are shifting you, and I'll make all arrangements over there. I will arrange for your bloods and medicines, and also I'll inform in the OT, because sometimes we have to, if labor does not progress, then we may need to go for cesarean section. But that is the last option. But this is the benefit of having an equipped center, that everything is ready for you. Yeah, and also I'll ask the baby doctor to meet you and explain you further things about this, about the bowel opening by Jack. Yeah. Okay. So like this, okay, I'll document everything in your notes, and I'll make all arrangements. So like this, you have to go about the station. Any question? Any question anyone has? Am I clear so far?